Go and grab it. Okay, so there is a signal asking you that this session is about to be recorded. Do you consent to it? Just click on OK. If you click on the other button, you are going to be exited automatically by Zoom. So that is not within our power. You can see now somebody left. It's not because the person wanted to leave, but he clicked on the other button. So it's automatic. They will log him out. It means he didn't consent, but she has joined us back now. So that's how it works. Once again, welcome to Express platform. We are here to support your interview journey. I don't know if you guys can see me and you can hear me clearly. I believe you are all hearing me clearly. So we are here to support your interview journey. This is more like an extension of Express job application services, and it double up with interview preparatory services. Yes, we've been doing job application, and sometimes people get some job offer, and some other time people are not getting job offer, and then we discover that a lot of person getting job offer. If you are not speaking, mute your mic, please. Yeah, please, thanks. So we discovered that some of you will go for interview, and after taking a whole lot to be able to secure that interview, some will go and flop. Not because they don't know well enough, but simply because they don't know the approach that they are supposed to follow. So that's why we launched this package to further support the Express community in acing that their interview. So far, God has been faithful, and we have been able to help large numbers of professionals grab that their interview dream, and smash their interview and gotten the offer. Our last session was quite inspiring because a large percentage of them that went for that interview ended up getting that offer. So it has been testimony on testimony. I believe that you must have seen a glimpse of it on the Telegram group, where we share past questions on the group for those who have just recently had their interview, and they share past interview experience. As we say, this is an avenue for us to come and make all the mistake or the errors before our interview, so that on that interview day, while people who are coming as a novice are speaking, you that will now become an expert because you know what is expected of you, you will be on the good side of the interviewer. So once again, welcome aboard. My name is Otaigbe. I'm not here alone. I'm with Mrs. Stella, who is also very, very instrumental to this brand in supporting our relocation journey. You will get to hear from her in the course of this interaction. We just started making this possible for both of us to hold this session. Sometimes we may handle it individually, differently. Another time, you may not be seeing our faces. You may see other members of the Express team. But the most important thing is you smashing that your interview. Please mute your mic, mute your mic, mute your mic. What is if you are not muting your mic, don't be surprised when they will remove you from this platform. Oyindamilola Olajide, please mute your mic.
Guys, just go on. I'll do that. Just go on. No need of repeating mute your mic. Thank you.
Okay. All right. Thank you so much. So today we'll try as much as possible to be practically oriented. I sent some past interview session for you to go through. I think that was our last session. It was supposed to act as a guide to you so that you will know what is expected preamble, so that we can focus on the major points for today. So hopefully we'll be practically oriented. Now, just to kind of integrate us to how the interview usually looks like. Sometimes you may be having 2 person, 3 person, or 4 persons in your interview day. Sometimes it can even be 1 person. Now, what happens is they are going to be asking you a series of questions that relates to the job you have applied for. Take notes, that relates to the job you have applied for, not just a random question. So that's why you need to prepare in line with the job you have applied for. Now, as we always say, you need to have a good background. And when we talk about background, I usually make reference to my own very background. You can see how my background is now. This is my house, so you can see the background. Some gadgets has that feature where you change the background to suit whatever you are having. So you can see that the background is going to change now. So it's blurred now, you can see. So you can see another background style. But because everything seems to be calm now, I'm using a natural background. So please take your time to experiment with your app. It's not on that day you will be asking yourself, oh, how did Mr. Tagbe do it that day? Oh, how did they just do this thing? The interview is going on. You are just choking your your hand on the on your phone. No, you don't do that. You will have one. You will have done justice by preparing ahead of time, so that on that day you will know that you are focused, fully focused on your interview. Now, you need to maintain a noise-free background. It's very, very important. If you know how to mute yourself when they are speaking, so that when you want to communicate, you can unmute. Or if you know you have actually maintained a noise-free background, you don't necessarily need to mute yourself. So you can actually listen to them so that in case they are asking you a question, you can easily respond without issues. Sometimes at the end of your interview session, your interview may ask you, do you have any question for us? Try to be creative and ask questions. It doesn't take anything away from you. Question to ask is always there. Do the trust support creativity? What are the rooms for professional development? And so on and so forth. They are all questions that you can actually ask. So beyond that, you may have some personal questions that you have actually reserved within you. But please try your best to ask some questions. Now, your preparation should always be in line with some certain criteria that have been outlined in your job application, which are what? Your job description, personal specification, your trust value, desired criteria, essential criteria. Now, you don't need to know all of them, but if it's few that you know, add them to your natural life and then begin to use it to practice so that on that day, everything will flow naturally. Don't cram, don't just memorize, but practice as if you are going for an interview. That is why it is an interview. Now, you should know your strength and weakness. Sometimes they may ask you questions relating to your strength and weakness. By all means, if you can relate some of those your strengths to what they are looking for in the job vacancy, that could also be a big advantage to you. So please try and note that down. Now, the most common questions when it comes to interview is relating to how to express about yourself. They will say, tell me about yourself. Whether you are going for Canada, you are going to US, you are going to Australia, you are going to UK, whichever top country you are going to, chances are you are going to always encounter that question. Tell us a brief about yourself. Now, we always tell you that this is an avenue for you to sell your brand, to sell you as an individual, to sell your skill as an individual. So you always want to follow a strategy. We are not telling you that Express strategy is the only strategy. You may have your own that work for you, no problem. But what we always say is start with your identity, which is your name, your school, your professional summary, which are your summary in relation to job, and then your skills. And then your skills should be related to what? The trust value and what they are requesting for in the job, which are what? The desired criteria or the essential criteria. So please let's quickly take note of all those. It's very, very important. Now, as you can see, this is going to stream live on YouTube. So if by chance you stumble across this video, it doesn't take you any deal of struggle to just click on the subscribe button because the channel will certainly help your journey. And we have a Telegram that we usually share past questions Now, these past questions are meant to sharpen that your implement or your tools. Now, this past question has been helping a whole lot of persons. Imagine going for an interview and you know what is expected of you. Chances are you will succeed. If you know that they are going to ask you this type of question, you will be able to prepare in line with it. Because most trust, they are going to repeat similar questions. They are not going to start inventing another type of question. Only few questions may be injected that are new, but by and large, you see that most of these questions, if you are interviewed for similar role, they will intertwine. So please take note of that. We have a Telegram group. Sometimes we put the group link on the description where you have access to previous past questions that other persons have encountered. They have shared their experience to help others. You too, when you eventually finish your interview, irrespective of the outcome, we appeal to you to please share your past question on the Telegram group or on this group where we are sharing the information so that it can help others that are going to be holding their interview tomorrow. Personally, I'm not requesting for another interview session, but it's for people like you tomorrow that are going to be having their session that will benefit from it. Think about it. Your colleague that had traveled many years ago, if you ask them now, what is the question they asked them when they were doing their interview? Many will not remember again. But if those things were written down somewhere stored, you can always refer your colleague and say, when I did my session, I shared it on this group. Just go straight to that group, use the pin messages, and you will be properly guided. You have solved a problem by so doing. So please, when
Mr.
you
Hayes, let
finish,
me badge in, please. Sorry.
yeah,
So while you're listening to Mr. Hayes, I put some questions on the chat box. Please let's try and reply so that we can tailor your interview towards tailor your and the interview towards you. If you don't know how to chat or reply the chat, but just click on that thing that looks like message sign and then you can put the answer there. Thank you, Mr. Hayes. You can go on.
okay, all right, thank you so much. So please, sharing those interview questions will help in giving guidance to those that will be writing tomorrow or in the future. Once again, we are happy to welcome you on board. Today will be practically oriented, so we are not going to be doing so much talking. I have done all the talking now, so it's going to be practically oriented. I know some of you are shy. You don't need to turn on your camera when you are speaking. That is clearly understandable. But please, you have to speak. It's very important because some of you, when you are planning for the interview, you feel you already know it. You feel you are capable. And then when the interview now happens, you now discover that it's not what you bargained for. So this is the time now you can come and make all the mistake. We are here to correct you. Come and make all the mistake. We are not charging you for this session. So we are here to help you make all the mistake, we correct it so that when you go to your interview tomorrow, you will be smiling or the examiner will be smiling while listening to you and will not just be nodding head even when you are saying the opposite of what they are expecting you to say. So that is basically it on that. Now, as usual, just to put us on the mode, this session is going to last for, let's say, we started by, let's say, around the 4:30. Hopefully, we should be done by, let's say, in an hour time or hour 30 minutes. An hour time, hour 30 minutes, depending on how we cooperate. So please, first and foremost, I can see that some of us we have different names on this platform. I'm happy that majority of us have our name as the name of our um, Zoom handle. Some of us are still using Infinix Hot 12 and iPhone. So please change that accordingly. If you watch our previous sessions, we've already told you the importance of changing your name to match with your personality. And please, you are using Zoom today now. Most trusts may not use Zoom to conduct an interview session with you. many will be using Microsoft Teams. I've told you before, Microsoft Teams is very cheap. It accommodates large number of people, unlike Zoom. So most times, the trust, sometimes they want to also conserve money and some other reason which they may also have. So please practice with both apps. You should know the app they are going to use for your interview. It's not enough for you to say, I'm used to modern technology, and they are not asking you, turn on your camera, you are doing like this. Where is it? Where is it? But you say you are used to a modern facility, and then that's already a red flag. So please familiarize with yourself with all these gadgets so that on that day you will know that you are in for something positive. Now, we've seen the timing that you are all having your interviews. Some are very close, some are a bit far off. But we'll try to focus on everybody now. Before we used to say, let's focus on those that are having interview very much quickly. But the thing is, we may not have another time to hold another session for you because time is of essence and we are very, very busy. So let's focus on everybody. If you are ready to address the question, you can just raise up your hand. Now, to raise up your hand on this Zoom app, if you click on your app, you will see that there are features at the bottom. The first one is the mute or speak. That is the mic button. The second one is the video. The third one is the participants. The fourth one, you see chat. That's where people are chatting. And then the other one is where you react. Maybe you like what I'm saying, you want to just react to it. And then there is also some other features such as share, record, caption, and so on and so forth. Now, in that section where you see reaction, when you click on that reaction, you will see the first thing they will say is raise hand. So when you raise hand, it's an indication that you are ready to actually speak. So you see that I've already done a Zoom tutorial for you guys. Anyway, so that's basically it on that. Now we are going to go straight to the session now. We'll begin by the popular question, which is tell me about yourself. So if you know you are ready to take the question, don't need to put on your camera if you don't want to, but unmute your mic and raise up your hand so that we'll know the people we are going to be asking these questions, and then we can take it from there. Be free. You are here, make all the mistake here. This place, we are not going to score you or say, oh, you don't, we can only correct you. But if you don't talk, you will go to that your exam and go and make the mistake there. And then you now come and be saying, oh, I will have spoken that day, or type we said it, or type we said it. You don't know how much you can really achieve when you speak. So let's start with Mrs. Choma or Miss Choma. Sorry if I may not have gotten your identity right. Precious Choma. So good afternoon, Miss Precious. My name is Taigbe Hayes. I'm going to be one of your interviewers for this interview session. It's going to be brief, roughly about 15 to 20 minutes. We should be done with this session. We've got a couple of our colleagues here. Andrew is from one of the ward. He's the ward manager. And my team member is here, Vincent. So we are going to be conducting these questions with you. Please try your best to compose, remain relaxed, and answer our questions. In a few minutes, we'll be done. We want to just assess to know if you are best fit for the role we have advertised for recently. Are you all right for us to proceed? Is Precious still here? Okay.
Yes.
Network. Oh, great. So are you all right for us to proceed?
Yes, you can proceed.
All right. Thank you so much. So please, can you tell us about yourself?
Okay, I'm Abuchi Precious Choma, a midwife, and I work in the labor ward. I have 4 years experience, and I schooled in University of Jos, that's the northern part of Nigeria to be precise. Also, I did my 1-year internship in Ogun State, which is at the southern part of Nigeria. And I also have experience in teaching because during my leisure time, I tend to read and I use the little time to teach. when necessary. I have a lot of skills related to what I do. As a midwife, I have the skill of monitoring labor, starting from the latent phase to when it becomes active. And what we also do at my unit is
Okay, so she's muted now. I don't know what happened. Maybe network or something. We
sorry,
can't
my
hear
mom
you.
tried calling. No, my
Oh,
mom tried calling. Sorry.
okay. All right, go ahead. So there's something you should learn there now. In the course of your interview, try and what? Silent every potential cause that can disrupt your interview session. If it means telling those close by persons that are always going to be calling you so that they don't need to disrupt your flow on that day, because one single
You can just
disruption.
use do not disturb
Yeah,
so that they will not be disturbed. Do not
yeah,
disturb immediately call.
yeah, but sometimes do not disturb. I don't know if it affects network as well, especially except you are using Wi-Fi.
No, it does not. People do not disturb. You don't get any call, no WhatsApp messages, no nothing.
Okay,
Just
great.
you.
So we can also practice it on this session now. You can actually activate do not disturb. It's just to scroll your phone down, you will see do not disturb button, click on it, and then you will not be disturbed. Okay, go ahead.
Okay, sorry for that. Sorry. Okay, like I said I have sorry I got distracted. I'm so sorry about that. Okay. Okay, I have the knowledge of taking care of women, that's family planning, where we tend to educate them on how to protect themselves and also use various form of family planning to avoid getting pregnant as of when they don't. And then we also teach them spacing, because once they space, it would also help them not just physically but also emotionally and mentally. Then one thing we also do in my unit where I work presently is we engage these women on healthy lifestyle, because as a woman you need to understand how to take care of your body, personal hygiene, which is very very important, because we as human beings need to keep our environment and our body clean. Then, as a human being, I have this trust value, which is openness, honesty, and trust. Now, in the terms of openness, I tend to be very open and I tend to be honest when giving out information to my clients. I want to let them know the complications and the importance of whatever decision they make. Now, let me take for instance, there's a woman we had that came in for antenatal, and that was her first issue, and she didn't understand what the whole process, the 9 months journey is all about. So because I had this honesty in me, I had to let her know that during this phase, which is the first trimester, she might be having some reactions or some symptoms where she won't really understand. And one of it is the nausea and vomiting that comes most times in the morning. So I had to be very honest with her to tell her that this is what she's going to be expecting. Now, for other people, this symptom might not be there because we have individual differences, but it's more common in most women, especially the first trimester of their 9 months. While in the latent phase, which is the third trimester, when they're already 7 to 8 months, their body tends to be very heavy. Both the pregnancy, they tend to feel like they're carrying a stone or something very heavy. So at that point, we just try them to tell them to engage in various exercise. Now, instead of taking Uber to work, they could take a little walk, like
Oh,
try to exercise, engage. If they have a partner that is very willing and supportive, they could go for evening walks. And then at that point, they should try as much as possible to engage in not stressful exercise, but
okay.
passive exercise.
Okay, Miss Precious, sorry, let me stop you now. Thank you so much for taking out your time to analyze those. You've really done well. Thank you so very much. But still, there are some major corrections that you need to take note of. Number one, your tell me about yourself is too lengthy. Number two, it is everywhere. You should have a centralized focus point. Now, you see all those stories you are talking about now, they are good for questions, scenario questions. Maybe they are telling you, how have you displayed this? Now, in the course of your conversation, you realize that you may mention of you have this trust value. You may not understand now. When you play this recording again, you hear when you were saying it that you have this trust value, which are honesty, openness, and this and that. You don't have trust value. You are a human being. You may have personal value, but be careful. Let it not appear as if you are copying their trust value and saying that you have this personal value. You understand? It's actually wisdom. You don't say it like that. You say it strategically so that it will look as if it's just flow. It's part of you. You understand? You may not necessarily say uh, your value in relation to their value, but you may see their value, pick one or two things, and add your own. But great attempt. Thank you so very much. I must also confess that I like the smartness of your picture. That is very good. And just before I move further, do you know your trust value? Is she still here? Network. Okay, she's still here. Do you know?
Yes,
Yes.
I'm here.
Okay.
Yes, okay.
What are your trust value?
Okay, honesty, openness, and okay, I use trust. I tend to trust people easily.
Correct. You see, you basically have taken their trust value and said you have these values. So they will know that and know that it's copy. So that will not be right. You understand? I have said it before in previous sessions. If you notice that your trust values are going to be honesty, openness, you can say you have a personal value of you are a good communicator, you are a leader, then you are open-minded. So what have you just done? You've taken one or two of their value, added to your own value, and that's it. That looks more natural. If you just say your value are their value, you say, oh, this one, we know our value. But of course, every person working in a facility that's into interview session knows their trust value. A regular staff that is now working for years may forget about their trust value. But those conducting interview, they always know their trust value. So please let's take note of that. Now, let me give room to one or two persons before we bring another person on board. Okay, it's not enough to correct you. Let me also give you a guide. Now, when you are doing a summary of your, tell me about yourself. We've said it before. Try and watch our previous session. It will really help. Start with your name. My name is Otaigbe His. My name is Choma Precious, a graduate of so and so university, which you have done. Following your graduation, you talk about what you did. Then when you are summarizing your career, you don't need to summarize everything. I believe you apply for a midwifery role. So just summarize key things about midwifery roles. Like currently I'm working in so and so facility where we use holistic nursing care or use holistic nursing care approach to render care for patients, doing this, doing that, and doing this. I am this, I am this, I am that. Are you getting? Those I am this, that, they are what? The summary of your skills. What are your skills? The summary of your skills. So when you summarize your skill, you stop. Further questions will come. That will give you an avenue to express yourself, give scenario proper. Because by the time you delay so much in one question, mind you, this whole interview process, they are all timed. And when they start stopping you, it can also cause a disruption. So please, let's take note of that. Now, if you have a contribution to what she's just done now, quickly unmute your mic and then state it before we bring another person on board so that we can all learn from each other. Now, if you know you have any critique, you have anything you could have added to that, or anything she should have added that she forgot to add, just state it. I'm not saying you should start talking on your own, saying your own, because you will soon say your own now. So is there anything? Few seconds. Okay. Few seconds gone. Okay, Miss Precious, I want you to also listen to others. Uh, Take your pen and biro and jot down relevant points. Somehow, there will be something you will get to add to what you already have. Let's bring on Miss Confidence. I don't know if it's Miss or Mrs. Miss Confidence, are you with me? Can you unmute your mic? Great.
Yes.
My, yeah, great. My name is Otaigbe Hayes. I'm going to be your interviewer for today. With me here is my colleague from one of the world. We are going to be asking you some questions. Be comfy, and we'll get to know whether you are fit for this job role. In a couple of minutes, we should be done. Can you tell us about yourself?
Okay. First of all, I want to thank you for giving me the opportunity to be interviewed today. My name is Confidence Chinyere. I am an international registered nurse who graduated from a reputable university, Abia State University, Uturu. My passion for patient care led me to acquire a skill in nursing. Before applying for this role, I read the job description and the person specification, and I am confident that I have the necessary skills to excel in this role. Over the years, I've been opportune to work in diverse healthcare settings, including the community setting, and I've also been opportune to work in a setting where effective communication is a norm. I conduct thorough assessments, planning, implementation, and evaluation of patient care. I act as a mentor, and I teach new nurses, the students in my unit, in order for them to excel in their respective role. I respect my patients, my colleagues, and their families, and I always demonstrate my hospital values at all times. Um, I maintain effective teamwork and collaboration to ensure that my my team and myself are on the same page with my patient care in order to develop a comprehensive care plan for a better patient outcome. I am drawn to your trust because of its commitment to providing a patient-centered care and holistic care, and I believe that it aligns perfectly with I believe that your values aligns perfectly with my own experience and knowledge. If given the opportunity to work for your trust, I am committed to upholding the code of and conduct laid down by your trust. I will maintain continuous professional development. I am flexible and adaptable, which means that I am ready to adjust to any new development in the care plan of our patient to in order to get a better patient outcome. Thank you.
Great. Thank you so much. Now, comment. What do you guys think?
That's what I think.
Okay. So what does anybody have any comments? Be free. Don't come and do I don't know now if I say he did well. What if I didn't do well during my own? Come here, make all the mistake. What do you think? Is there anything you think she should have added? Now you see that directly or indirectly, she have spoken about their trust value in the course of our interaction. She has not absolutely make it clear this is their trust value. But at some point in the course of our interaction, she has touched all those things. So that is the way to go. So if you go that way, you will see that the examiner will be marking a tick. All these things, and she didn't just do it because she knows how to do it. It takes practice. Yeah, if you ask her to do it again, she will do similar approach. So it takes practice. You will have done it over and over and over again. I always say that you have been looking for this interview or this one, and you have gotten it. Put your effort into it as if your life depends on it. Smash it and know that, okay, you have one already. While you are also grabbing for another one, chasing other application, you know that, okay, you have one bed in your hand. that is what worth more than thousands in the bush. I will not talk so much about that. Miss Confidence, you really done well. Take your hand down now. So let's bring another person. The good thing about this session is it's recorded. When you play her session again, you will have gotten how she answers some of these questions. Okay, let's bring her on board again. Miss Confidence, what is your trust value?
My trust value is compassion, respect, empowerment, and partnership.
Okay. So do you feel that in the course of your interaction, you integrated this trust value in your conversation?
Yes, I demonstrated 3. That is respect, compassion, and partnership.
Okay. You also spoke about how you are quite zealous about educating the younger ones, especially in training. So that was part of your conversation, which in turn also align with your trust value without you necessarily having to mention the trust value directly. Do you understand?
Yes.
So that's also another thumbs up. So a lot you can learn from our conversation. So let's bring on Lady P. Lady P, good afternoon. Can you kindly unmute your mic? My name is Ehis. I'm one of
Yes, sir. Good afternoon, sir.
Thank you. Nice to meet you. So my name is Ehis. I'm one of the persons conducting this interview session with you today. With me is one of the ward manager of the ward which you are going to be interviewed for. We want you to be relaxed, answer our questions. Hopefully, we will determine whether you are best fit for this role. Can you give us a brief summary about your career?
Okay. Good evening. My name is Prudence Chinomso Ihemesi. I am an active member of the multidisciplinary team with over 5 years experience working in an acute hospital setting. I have a bachelor's degree in nursing science. I have 3 years experience working in the surgical assessment unit and 2 years experience working in the theater unit. Over the years, I have learned under the mentorship of a senior surgical nurse, whereby I developed a lot of skills. I've also learned the ability to prioritize workload, the principles of triaging, carrying out continuous professional development, whereby I've attended training sections, both physically and online, including ECG, cardiopulmonary resuscitation, and other ENB courses. I've also I've been educated on the importance of using care planning, which has made me to develop a comprehensive person-centered care plan for patients, making my work to be seamless and flawless. In my current role at the surgical assessment unit, I am leading a team of about 14 to 15 nurses, whereby we cater for surgical patients. Pre-operatively, that's before the surgical procedures, I conduct physical examination, review patients' medical histories, and ensure patient is well prepared for the surgical procedure. I also, as a patient educator, I educate patients on the surgical procedure. I also collaborate with the multidisciplinary team, which is the anesthetists, the surgeons, the surgical technologies, even the physiotherapists and dietitians, in order to have a seamless coordination of patient care. I have good prioritization skills whereby I organize workloads, making use of my own initiatives in order to solve problems. I'm competent in the use of cannulation, catheterization, both male and female, venipuncture, suturing, removal of sutures, wound dressing, and also administration of intravenous drugs and documentation. I have the ability to work independently without the supervision of a senior nurse. I have good teaching skills and mentoring skills whereby I mentor junior staffs and nurses throughout their nursing practice. Whereby I mentor junior staffs and nursing throughout their nursing practice. I am very resilient, I am caring, I am ambitious, I am accountable to my actions, I am responsible for patient safety, I am compassionate, I am punctual, I am very caring, I have a positive attitude towards work, I am very flexible. I have a flexible pattern for work. I can work all shifts, morning, night, afternoon, evening, out of hours, in order to meet the needs of a service. Also, in order to meet the needs of the service, also I have good time management skills whereby I ensure to set my objective goals, managing time in order to meet patients' needs, in order to meet up with patients' needs on time. I'm very respectful. I am committed. I ensure to always participate, contributing ideas in the multidisciplinary team. I am always ready to receive corrections towards my mistake. I also carry out self-reflecting and debriefing in all sections. Self-reflecting and debriefing in all sections. I have good basic IT skills, which both that is basic in information technology, both Microsoft Word and Micro Excel. I'm good in the use of electronic health records, whereby I document and update patient current records. I am
Okay.
also willing to receive training in all areas of weakness.
Okay, good. Thanks.
Okay.
Thanks so much. I have to stop you because during your session, they may not give you this ample of time to keep talking. At some point, they may have to stop you because it's very long now. Well structured, good works. Your skills, they are so plenty. Please narrow them down to the most important ones. The most important ones as it what? As it relates to your trust value and you as a person, your personal values. Are you getting it? Now, I believe that most of those your skills that you were demonstrating, such as you knowing how to cannulate, catheterize, they are in reference to your job description. Is that so? Is she still
Yes,
here?
sir.
Yeah, they are in reference to your job description. So that's a good one. That's a positive one. So let's hear comments. What do you guys think of her performance?
Too long.
Too long. Okay. So who else?
Um, it was long, like everybody said, and I feel like she needs to what she needs to look at the job description and then the person specification. There are some things that they call essential criteria. When they mean essential, they mean you must have that criteria. So those essential qualities that they need the person to have, you can pick those essential qualities and use them while you're also using the trust value you get. And but you must not necessarily mention the trust value. You can just somehow integrate it here. But you can use those skills and then don't make it too long, because it was at some point I was like, my God, isn't she not going to stop? So I'm
Okay.
sorry, but yeah, it was kind of very lengthy. But not that you didn't do well. You did very well, right? Very, very well. It's just that you need to just not be not you don't need to say everything. You just need to be targeted, like look at what they really want, that essential skill, and use it to amplify. You can then add one or two extra to it. So that's what I want to say. And I also felt like personally, I felt like you were reading a book. I
Yeah.
don't know. I don't know if you were reading, but I felt you
Yeah.
were reading a book. And so I don't know if you were reading, to be fair, because I can't see you. But if you were reading, or maybe if you've written it how you want to say it, fine. Maybe that's how some people learn by cramming, while some people learn by using their personal experience. Maybe that's how you want to learn. But you just need to be careful, because they might twist the question, and in your mind, that's what you think they are saying, and you don't know that they've actually twisted the question and wanted you to say something else. So that's why we always tell you that you need to mirror, or you need to bring in your own experience, then bring in their person specification, and also you need to bring in their trust value, and that's how you need to answer that question. I like the progression. I like how you went, like the progression. It has different paragraphs. If it was writing, we were writing, which is quite good, because each paragraph focused on different things, which is good, but it was kind of lengthy when you got to your skills. Thank you.
All right. Thank you so much, Mrs. Stella. Just to quickly add, you probably may not have written it down. You probably may as well have written it down. But take note, it's a bit lengthy. You have some very beautiful points. So hold on to the key points. You don't need to say everything. Why? Because what if they stop you? What if they stop you? It's like, how will I say this now? It's like you are approaching IELTS questions. Now they say all questions carry equal mark. You have 20 questions to answer. Now you saw question number one, very easy. Question number two, very easy. Then you now met question number three. It's very tough. Then you are struggling. You are saying, I will do it like this. Oh, what if I do it like this? But all questions carry equal mark. Why are you wasting time in one question? What if the time not finish and you have some questions that will be very cheap? It's just for you to tick it and you've gotten the answer. You deny yourself of those. So that's why you have to what? Structure your session in such a way that it will be brief, but yet very impactful. So anything that you feel is not necessary, you skip it. You strike it out. This is not going to be a part of my conversation. Strike. Okay, this is not going to be a part of but this will be a part of my conversation. But if time is permitted, if they didn't stop me, I can bring this one in. Are you getting it now? If they didn't stop me, I can bring this one in. So when you are doing interview, prioritize the skill you want to talk about, prioritize your personal, the value you want to discuss, and don't bring everything in. Because if you bring everything and they stop you, the essential one that they are looking for, you may not even get there. They will say, okay, let's move to the next question. You understand? So remember, tell me about yourself is an opportunity to create a first impression that can be very lasting. So kudos to you on that. And hopefully, in the course of the session, you can also play the voice, play the what they call it, the session again. You'll be able to have a grasp of the little error that could be corrected, especially on the area. Now, you see that she said that you probably have written this thing down. I actually thought the same because at some point you will be talking, you will now say from where you stop, it's like you are reflecting on your previous paragraph. You understand? So that's a sign of when you are doing script reading. So you shouldn't script read. I know it may get used to you, but don't script read. Now, the point is, if you script read, it's difficult for you to cut some part out. When they are telling you to summarize, it will be hard because you have a fixed mind that this is what you must cover. You understand? But kudos to you. A nice attempt. Just little things to work on, and then you are good to go. Let's bring on Mr. Solomon. So I think this should be a May. Mr. Solomon, good afternoon. Good evening. My name is Otaigbe. Is one of your interviewer for this session. I want you to be relaxed. We want to just have a chat to know whether you are best fit for the role we recently advertised for. Could you mind giving us a brief about yourself? Now, mind you,
Thank you.
before I proceed, sorry, before you come in, tell me about yourself must not always be tell me about yourself. Sometimes it has to be tell me about your career summary. It can be, can we get to meet you? It can be, can we have you on board? It can be different way they may bring the question in. But anything that is relating to your personal is basically relating to what? Tell me about yourself. So please, Mr. Solomon, go ahead.
Thank you very much for giving me the opportunity to be interviewed. My name is Solomon Rimamchirika. I am a graduate of Ahmadu Bello University, 2011. From there, in 2017, I obtained a postgraduate diploma in education from Ahmadu Bello University, where I used a certificate to register as a nurse educator with Nursing and Midwifery Council of Nigeria. In 2022, I obtained a diploma in pediatric nursing from Ahmadu Bello University Teaching Hospital, where I was also registered with Nursing and Midwifery Council of Nigeria as a registered pediatric nurse. Immediately after my graduation from the university, I had a friend recommendation of which I was employed to teach as a nurse educator in School of Midwifery St. Louis, Sonkwa in Kaduna State. That I did for a period of about 2 years, from 2011 to 2013. Between the period where I was doing that job, I also went for my NYC, where I work in the general hospital. Within the general hospital, I had a lot of experience ranging from surgical care, medical care, midwifery. In fact, it is in that hospital I took my first delivery, and it was a priming. It was successful. I used the pathograph to monitor that labor. In 2013, I secured a job with Federal Medical Center, Birnin Kebbi, where I am working presently. It is a hospital that is about 350 to 400 beds. I've been in the pediatric section for over 10 years, and presently I work in the neonatal intensive care unit, where we manage babies that are sick, some with jaundice, some are preterm, extreme preterm of 28-week gestation, 26-week gestation, 32-week gestation, and we also manage babies with perinatal asphyxia, severe perinatal asphyxia. We use a lot of gadgets ranging from incubator, phototherapy, functioning machine, radiant warmer, resuscitator, and a lot of machines a lot of equipment that we make use of to monitor our baby. I'm someone who is very honest and accountable. I work with professional teams, and I respect member of the team. We make use of the team, the professional team, the doctors, the nurses, and all other persons to manage our babies very well. We have make use of our teams to manage a preterm baby which was 28-week gestation successfully. The baby spends 50 days in our unit, and through our careful and compassionate service, the baby was able to survive despite the fact that there may be one challenges here and there, but it was discharged, and today the baby is doing well. I'm also someone who is very punctual to service, very honest, very accountable. I communicate well. I'm a leader. Currently, I am the the deputy in charge of my unit, where I trained student nurses, mentor junior nurses or subordinate nurses that are working with me, put them through a nursing process. And one of the key things I'm trying to do in my unit at the moment is inventing the word bedside nursing. That if you are a nurse working in the ward, you have to stay with your patient and observe, because observation and infection prevention control is very, very key in neonatal care. These are few I can say about me for now. Thank you very much for the opportunity once again.
Okay, kudos to you. Sorry, I was muted before. Kudos to you. You've done very, very well. Now, yeah, you've done very, very well, especially with relation to the topic. I believe you are going for midwifery. Something tells me that both you and the other lady that spoke first are going to be going for the same trust. So with your trust value, I can easily detect that. Now, do you know your trust value?
Yes, sir. Honesty, accountability, compassionate communication.
Great. So both of you are going to be going for the same trust. I can easily sense that. Now, I love the fact that when this thing was getting to a point, I would say, oh, it's getting too long, you stop. Now, leadership is not one of their essential criteria. If it was, I would have told you that, okay, try and bring it as one of your keynote message you are going to pass before you get to the end, because you want to bring in the good things first. Because obviously, if you present yourself for an interview and you are telling somebody you are a leader, this is your leadership with proof. Of course, it's going to give you a big edge. You understand? So please take note of that. Now let's also listen to other persons. What do you guys say? Let's look at what the point Mr. Solomon has addressed and how he spoke about himself. What do you think he didn't do right, or what he could have done better? So please feel free. Unmute your mic and speak. Unmute your mic.
Yeah, thank you very much. Everybody that has participated, I salute your courage. It takes a lot to actually hear yourself speak or something like that. I salute you guys' courage, and I want to first of all apologize. maybe not judging you from the corner of my own small phone, but just want to chip this in that one thing that I feel that is making tell me about yourself lengthy, especially for the first speaker and the last speaker, is that they tend to use the word "we did this," "we are doing this," "we have done this" in the tell me about yourself context. Yes, it's good that you want to highlight the fact that you work within a team, but I mean, when you've referenced it once, I think it's okay like that. You don't have to keep going. We've done this, we did that, we did that. I'm so sure that in the course of the interview, there will still be chances where you would have to talk about what specifically you are doing as a nurse. And even when you do that, you still, at least from my own research, it's advised not to use the word we too far because they are interviewing an individual, not a team of people.
Yeah, go ahead. Sorry, that person probably unmuted himself. Or have you finished?
Yes, I have.
Oh, great. Thank you so very much. Yeah, she has actually raised some valuable points. Now, the question was, tell me about yourself. You understand? So if you reference your team efforts, it's not as if it's bad, but don't focus too much on it. What you guys did so together, but rather let it be a summary about your skills. And what you can always do, all these things, we've done it before over and over again. I gave you a guide on this is how to address tell me about yourself. In few seconds, you're actually done. You will see that you will pinpoint all the essential points. You have access to our YouTube videos. It's just for you to look for the previous interview sessions. If you don't have the energy, you may not watch all the videos to the end. But the first few minutes, it will have already give you a glimpse of this is how to address tell me about yourself. People that have done their interview, gotten offer, that have also spoken, you will also be able to have a glimpse from them. But kudos, I think all the speakers have done well, but little corrections, which I believe we have spotted in the course of this interaction. So I'll give the mic to Mrs. Stella now, who will
Please,
take it
can I
further.
say something before?
Yeah.
Can I
Go
say
ahead.
something?
Go ahead,
Uh,
please.
okay. I feel like he spoke well, but I feel like it was more like a scenario question because he was saying something about how they deliver the prime if something like that. So
Yes,
that's
that
what I
is
feel.
yes, you are right. The same thing we are talking about, that it should not be focused on we, but rather it should be focused on his personality. You understand? So you don't need to explain all those. There will come a time. The truth is, if you say everything that you are not supposed to say in your tell me about yourself, by the time they start asking you about scenario questions, you will start repeating the same thing. To look as if, oh, you haven't had so much experience as you say, because if you had so much experience, you would have had other way to summarize that same question or provide that answer. So please, the best thing to save time wasting, if you can, go straight to previous video done. It will really go a long way to guide you on. That's why I sent this previous video, one of the previous video on the group. There are so many videos we've done before. Just watch few of them. Take your time. It's very hard to get off interview now. So the one you get, you want to take it to heart. Very important. And for everyone applying for midwifery, take note, some trusts, they may just open this thing, what they call it, monitoring of fetal heart sound. So they will just put it for you and say you should read. So it can be strange with some trusts. So don't be taken unaware. And we've addressed these sort of questions in our previous session. So, Mr. Solomon, you can take your hand down now so that we can bring in every other person for the next session, which is going to be the question proper. Ms. Stella is going to anchor this now. Mrs. Stella, please go ahead. The mic is yours.
Okay. It's question and answer section. I used to like this section very well. Okay, it's just to ask us some questions. It's nothing, no big deal. But please, while we are asking the questions, I would like to request that we all speak, because it has to flow, you understand? And it's going to help you, especially when they are asking you this question, you already have an answer. So this is kind of scenario-based question. So all those people that have been giving scenarios, which you're not supposed to, maybe you're telling me about yourself, you know, even if you want to give an example, just a single word is okay, or a single sentence. Where scenario based question comes in, that's where you start giving all these clinical scenarios and all that, because you want to tell them, I have done it, I have done it. So this is the section we do all that. I asked everybody a question before we started, and my question I asked on the group or the chat box, what I asked was, can you tell me your trust? Can you tell me the which profession? And I can see everybody here are nurses. I thought we were having care assistants, but that's fine. So I asked what's the name of your trust? I asked you which position are you going for? And majority of everyone here is going for mental health nurse, going for general nurse, going for medical nurses, going for surgical nurse. Those that are going for anything related to intensive care is still related to all the surgical, operative, and all that. So it's most of their questions are kind of related somehow. So it's not going to be much of a difference, or there will not be so much difference in the question, especially because the role you guys are applying for is the role of a band 5. And because the role of a band 5 is what we are applying for, you might not get so much specialty questions, more of a general questions. Because even if I also saw cardiothoracic, yeah, because even if where you are going for a cardiothoracic application, the post they put there is the post of an adult nurse in a cardiothoracic, because at times they might take you, depends on, maybe you have experience in the cardiothoracic ward, you might not even have experience there, but you've done something, you've done nursing, you've nursed, and they believe that when you now come in, you are bringing in your nursing qualification into their unit, you'll be able to adapt to their environment and learn quicker. So it will not be like so much it won't be a big deal to easily adjust and all that. So when you are talking about scenario-based questions are basically like for you to understand what they will ask you. That's why for you to even know the kind of scenario-based questions, is there any way to stop calls? Because the do not disturb isn't giving a good result. I had a call. Do not disturb supposed to work, supposed to prevent you from taking in any calls at the moment. You should check if you have any restriction in your do not disturb, because it's supposed to prevent any calls. Like it will come in, but it will just silence it straight up. It won't even like disturb you in what you are doing. Okay, so let me go back to what I was saying. So when you are thinking about scenario-based question, there's a cheat. I always tell people that interviews are cheats. Like they've already given you a cheat answer. They've already given you a possible question that they will ask how. They've told you the person's specification. They've put the essential criteria of what they want and the essential thing the person might have probably done. Then they've put in the job description of what the person will be doing. And also, they've put in like a brief description of what the job is all about. There's someone that posted here that she's going for a 0 to 19 leads interview. And I just did a research on it. And I found out that you'll be working with community nurses, working with, with health visiting, and you have opportunity to be improved. If you get a post, you have an opportunity for the trust to sponsor you in the university to a higher degree. So me just having a glimpse of what that job description is, having a glimpse of what they have put down there in describing what the role is, I already understand the type of questions that will be coming. And the type of questions that will be coming is kind of community-based questions. And also, you can see that they said you have to they take care of people in the home, in their own house. They take care of also kids. They take care of both the elderly. So you already know that the kind of interview or interview-based question they'll be asking you is kind of related to, okay, you go to somebody's house and this happened, what will you do? Or how will you know someone have a high blood sugar? What will you do? It's kind of community-based scenario. So it already gives you that mindset of, oh, this is the type of questions that will come out. Let me go and study in relation to that type of question. So I will go in depth into studying community staff nurse role. Okay, that's it. So you having an understanding. So whenever we say job description, we are not just saying it as per people are saying, they're always saying job description. No, because the expo on how to pass your interview, it's already in there. It's already in there. The expo on how to pass your interview, all you are just coming to do is to come and display, to come and act film. That you have done this thing before and you can do it again. So you're just coming to act film. Okay, so that's what we're coming to do on our interview section, right? So that's it. And then another thing we need to understand is some type of questions that they will ask you in your interview. For someone that is a mental health nurse now, you should be thinking about your mental capacity acts. You need to understand them. You need to understand safeguarding. You need to understand abuse. You need to understand risk assessment, risk management. Okay, you need to understand, this is like, if we want to go specific now to mental health, you need to understand the mental capacity and all that. So those are some like side effect of some drugs that may happen. Okay, so for someone that is going for community-based question, I've already spoken about that initially. For someone that is going for surgical questions, pre-operative or ICU, you need to understand that they will ask you clinical-based questions, like maybe some vitals. They might use some vitals as example. What will you do, or how you will notice shock, or how you will notice all those things. So you need to have that concept of, okay, this is what they'll probably ask me, because why? You have gone through the job description and you have gone through the summary of what the job is all about, and you've read through it, and you have a glimpse of what you just sit down and picture. So this is what they say this nurse will be doing on a daily basis, right? So they'll probably ask me questions in relation to that. They'll ask me questions in relation to that. Now, for someone that's going for the role of medical, surgical, also they'll ask you surgical, they'll ask you related to pre-operative, post-operative, medical, they'll ask you related to maybe people that have this Alzheimer's and all that. For those in Canada, I've seen Canada, yes, it's the same thing. Nursing is nursing everywhere. Whether you're going to Canada, you're going to the UK, the most important question is, what are you going to work as? Are you going to work as a nurse, or are you going to work as what they call it? Are you going to work as any other profession? Now, if you're going to work as a nurse, right? And for what I've even been hearing from people that have been going for Canada, their questions are not even hard. They will ask you, tell me about yourself. They will ask you, why do you want to work for us? Those are general questions, okay? So I've talked about in specialty now. Now, you having that concept is one. Another thing you also want to understand is that when you are going for these questions, after they tell me about yourself questions, they will also ask you general nursing question. You say you're a nurse, Abi. Okay, come and prove to us you're a nurse. This is what they will ask you first before they start going into depth to your specialty questions, right? After they've asked you, or they may not ask you to tell me about yourself, but they will ask you general questions. Sorry, if I keep quiet, that means I'm trying to mute people that are putting on their mic. So they'll ask you general questions, okay, general questions in nursing, and we're going to be dealing with all of that. Now, another thing you also want to understand as nursing, because nursing is all about giving care to people, being compassionate, risk management, and all that. So what you want to understand as a nurse is that whenever you're going for a nurse interview, your questions will be surrounded around nursing. Now, when I mean nursing, they have different topics your questions will be surrounded about. Medications error, medication calculation, conflict management. Okay, conflict management. When what are they calling it? If someone is not satisfied with your care, what's your actions? Yes, so that one is there. Your escalation plans. I applied to a international nursing recruitment. I don't know if the specific role. Sorry, let me see. If this should I focus on graduate nurse role and currently. So the person that puts this, I will come to answer that. Let me continue what I'm saying so that I will not be distracted. Okay. Conflict management, like I said, right? And you need to understand what are your escalations plan, pressure ulcers management, okay, hazard management, okay, falls management, nutrition based questions, interpersonal based questions, like your interpersonal relationship with your colleagues. To ask you questions surrounding that. So, and they might ask you questions in relation to maybe some laws. You understand, like maybe tell me, or the role. Tell me your role. What do you have a concept of what a surgical nurse role is all about? What's your concept of a surgical role? So they want to have an understanding, that you have an understanding of the job role that you are going for. They want you to explain that, okay? They also ask you questions like maybe they might ask you questions related to what's this principles of nursing, 6 years of nursing, or all that. So you having all this understanding of all these questions makes you prepared that no matter the question that they give me, I already have an answer. Another cheat I used to tell people is envision them asking you questions in this topic and have a specific example for each of them. Okay, have a specific example for each of them. If you are being asked this type of question, have a specific example. Now, specific example, such as maybe they asked me about like when I went for a certain interview then, and it was like a senior role, and I already had like an example for each questions they were going to ask me, so that I won't repeat myself and they will see that I have an experience. And all I was doing was just to use my recent experience in the hospital to give an example. Okay, they talked about what do you do when the patient, you're communicating to the patient and the patient is difficult. And I remember I had a patient recently that people were struggling to attend to, and I was the one that was able to speak to the patient. So just chipping all those things and giving little example helps you to have an understanding of the question. So that's the summary of what I want to say before I go straight to ask the question proper. And anybody that if you have a question or the chat box, I will attend to that when we finish this question and answer section. So my number one question is going to start with the general nursing questions, okay? Then before we start going straight to other questions. Now, general questions that they will ask you is, why do you think you are best fit for the role you are applying for? I just need 2 people for each question so that we can cover a lot. If not, we will not be able to cover a lot. So why do you think you are best fit for this role that you are applying? You need to give an answer based on your own interview day or your interview expectations and the expectations from you. So tell us why you think you are the best person they should take you for the role that you are applying for. Just 2 people. Thank you.
Thank you very much. Once again, my name is Solomon Remamchirika. I think I'm best for this role because I have a lot of experience in nursing care, over 10 years. I have worked in the community where I usually give vaccination, monitor elderly patients with diabetic and hypertension, give health talk in school environment, and referred adolescents to assess lab investigations and treatment in the hospital when I go to school to give health talk. So I have worked in the community, I have community experience, of which when I put it side on side with what is being described or what you are looking for, the kind of personnel you are looking for, I think I meet the criteria. It's community-based, and I have community-based experience. And I think I will bring that experience into your organization, and you will be happy having me as one of your personnel. Thank you.
Okay. So what else will differentiate you being a community person? Because if I am a community person as well, so, and I'm having that interview with you, why would they take you, that is that community person, over me, that's also a community person?
Yes, I didn't only involved in clinical nursing in the community. I'm also someone that carry out research, community-based research. I've done community-based research on psychosocial aspect of adolescent delinquency. I've done community-based research on hepatitis, HPV vaccine, and I have other community-based studies that I'm involved currently. So not only on clinical aspect in the community, but I also get involved in research aspect of the community. So in collaboration with research aspect and clinical aspect, I want to believe that I will bring an innovation into the community that will improve the general, that will help achieve the general goal of the organization. Thank you.
Thank you so much. Now, that is what I want you to say. Apart from the fact that you are in the community and it's a community base, which is also good, you also need to have the concept that another person too might be in the community. So what else would distinct me as a person from that also individual? So you need to add that in your interview section, leaving no stone unturned, okay? And also maybe there are other essential criteria or qualities that they want. You don't need to mention too much. Number one, you mentioned about you a community experienced person. That's number one. Number two, you mentioned that you're a research-based person and you'll be innovative because it's already what you are doing and all that. That's number two. Then you can bring in one more to make it three. And then you know that yes, this three is what I'm going to use when they ask me this particular question and I'm going to smash it. Okay? So thank you for that answer. Now, let's have another person give an answer to that question. Thank you. And remember, you're speaking specific on your own interview that you're having. Okay. So why do you think you are best fit for the role? So I need another person to give an answer.
Okay. Good evening.
Good evening.
Okay. Abuchi Precious Choma. The reason why I'm best fit for this particular role I'm applying for as a midwife, I'm knowledgeable in the aspect of labor because I have the idea of what it takes to go through the whole 9 months. I tend to educate women on what they need to expect during this whole phase of 9 months and the things they need to do and things they ought not to do. Then I also provide accurate information on prenatal care because with this information, I'm informing them to let them know and also make them know that there are certain things that they should do and they should not do. That's the do's and don'ts in pregnancy. Then another thing again, I have to allay anxiety. These are expecting mothers. So some of them don't know what it entails and they don't know what is coming. So they are anxious. So with my knowledge, I would have to allay that anxiety they are having and that feeling of unknown. So I have to encourage them and also show other, because there's this thing that comes with when you tell somebody, oh, this person has gone through this phase. So I would try to introduce someone that has gone through the whole 9 months period. The person also share his or her testimony to the present woman that is actually going through that. So with that, it encourages them and she would be able to know that it is something that is doable because there's this normal idea that they come with.
Okay, wait,
is difficult.
Let me stop you. Wait, I don't want you to keep going far. I had one interview, okay? I'm speaking from experience. I had one interview one time, and one of the reasons the person told me I didn't pass an interview was this question. The question was simple: why did I think I'm the best person for the role? And the answer I gave, that was a long time ago. The answer I gave was the way you are going about it. I was explaining what the person will have to do in the role, what the person and all that. And the person said, I didn't give an answer to that question. The question is, why do you think we should give you this position? Why do you think you are the best person for the role? So now you're going to answer that question. I'm not giving that question to any other person. You have to answer that question. And I feel like you have the answer. Okay, it's just for you to structure it very well. Why you think you're the best person. Now, how you go about this answer is think about maybe 3 or 4. Can you hear me? Are you here?
Yes, I'm still here. I can hear you.
Okay, who is speaking? The person should not distract me. I'm trying to help you so you can. Okay, thank you. The person has muted itself already. Okay. So how you go about answering this question, right? Look for maybe 3 or 4 things that you want to highlight on. If it's education, like you know how to give good education very well to this thing, and you are very good and you have experience, use that one as number 1. Explain it with few, like maybe use the STAR technique, the situation, task, action, and recommendation. You can use that. You just don't talk too much on it, but just explain how you are best on it and how you are doing it. If that's your number 1 reason, then you enter number 2, number 3, and number 4. So why do you think, out of everybody that's applying for this role, why should we take you?
Okay. All right. So because I'm knowledgeable in the aspect of educating women on how to take care of themselves through the stage of 9 months, I think I'm actually best fit for this particular job, because I'm going to enlighten them and give them the accurate information they need that would help them through this phase of 9 months. And another point again is I would help them, because most times they are very anxious. So because they are anxious, I would want to allay that anxiety that they have. So with that, they'll be able to go through the process without feeling awkward or feeling weird.
So that means you are saying you have good communication skills. So you know how to speak to them, bringing yourself towards them, being emotionally available for them. So you have experience in doing that, knowing how to reduce their anxiety. And because you've had experience in doing all of this, and you've had comments, you've had like praises from both staff and also from your other patient, how you've helped in different situations in helping to relieve the anxiety through your good communication skill. You feel like you bringing that, you are good for this show. What's your next point?
Okay. Then my next point again is where I would also have to bring in support, because these women, they need support both physically, emotionally, and mentally. So I'm going to be standing in for them to give them support.
You're
To support them.
advocating and you're supporting them. I'm trying to refine your words so that you will know how you're going about it. So continue, I'm listening.
Okay. So in this way, I would actually stand in the gap to also help them financially too, because sometimes a lot of them are not prepared for what's it's coming. So in case of, I also have to teach them how to financially save for the child that they are bringing into the world, because this child, it's more like they need a lot of finance to be able to take care of this child. So I'm going to be teaching them on how to save too for in expecting a child.
Okay. So don't be tense, Start again. I want you to get this answer. Like, I want you to get this answer very, very well, right? And also, I want what I want to give you as an assignment, right? Is I want you to go and look at their person specification. Do they say the kind of person they want is for someone that will help them financially? Have you read the person specification? What kind of person did they say they want in their essential criteria?
Okay, the essential criteria. Let me just, sorry, I just have to just like go through it.
Yes, I want you to get this answer because you must get it.
Ma, please let another person speak so that she can have her time and arrange her work before she can speak.
All right, that's fine. That's what I will do then.
Sorry.
All right.
Before you go ahead, just let me quickly chip this in. Now, the best way, as we always say, is interview is what? Telling the interviewer what they want to hear. So they have what they want to hear. Yours is just to tell them what they want to hear. And what
Exactly.
they want to hear is available. They're asking, okay, why do you want to work for our trust? Did they not write it down that this is what they are
The question
looking
is why you are best for the role.
for? Okay,
Why you are
why you are
best.
best for the role. Okay, good. Now they wrote it down what they were looking for, right? Now you believe you have what you are looking for. All you don't need to tell them now is why you feel you having this thing, you have an advantage over others. So if you
Exactly.
don't know what they are looking for, how will you know why you are best for the role?
Exactly. That's what I want to hear. The
So
first question is
work with that, very important. So take
All
your
right,
time.
so I've seen it.
No,
Okay.
take your time. Take
All
your
right,
time.
thank
Take
you.
your time. Take your time. I'll come back to you. If I don't
Yeah,
come back
you
to
have
you,
the time. So that
If I don't come back to you, make sure you say it that you are waiting. Okay.
no, she'll come back to you definitely. We are still here.
Okay. So let another person give an answer so that at least you have one more person.
Okay. I believe my experience in accident and emergency units has equipped me with strong foundation in managing critical situations, making quick decisions, and also providing immediate care. And in fast-paced environments like the Central and Northwest London NHS Trust for the role of home first nurse practitioner, these skills are very, very crucial. And additionally, my background in community setting has helped me to develop effective communication and collaborative skills, not just for my colleagues alone, but for other healthcare professionals. And I understand the importance of seamless teamwork, especially in emergency situations. Also, my hands-on experience on AIE and community setting has prepared me well to contribute to the high standards of care in Central and Northwest London NHS Foundation Trust. Thank you.
That's straight to the point. Straight to the point. Straight. Why you think? Because you've got experience in different skills, and that's what they want. Okay. Let me give another example. I was asked why I think I was best for this position, and I told them, you guys said you want someone that is a good leader. I've had experience in this. I've been able to lead a team. I've been able to manage a ward in different situations. You said you need someone that has good critical thinking. I've worked in this environment. You say and I've been able to demonstrate this with my patients. I gave scenarios, okay? You guys say you need somebody that is very, very, that knows how to do triaging. Sorry? Okay, you can say you need someone that knows how to triage, know how to work in a high-paced area. And I have had experience in this. I've worked in this particular place. I've worked in this place and I've worked in this place. And so because of it, I've developed the skill. It seems seamless. You said you need someone that has good communication skill. I have that. I've done this in this. I know how to communicate with the patient in difficult situations. I know how to communicate to the patient family, know how to relate their informations. I know how to do that. And just 3 or 4 points, it's okay. Don't say you and be ticking. Yes, 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 yes. Because you have told them what they want. They say they want that person. I have it. So I'm the best person for it. Who else can you take if it's not me that already have what the skill that you say you need? Okay. So that's it about that question. So Mrs. I'm sorry, I don't know if you're Miss or Miss. Miss Precious, do you want to give an answer now so we could go to the next question?
Yes, I want. Yes, I do.
All right. Now, tell me why you think we should take you for the job role.
Okay. I'm actually experienced and I have the knowledge of communicating to women that are in labor. And I also have the experience of helping them to allay anxiety because they don't know what they're going to be facing. So I also have that particular experience and I could help them mentally and emotionally because pregnancy comes with a lot of challenges and a lot of fear and anxiety. So, but with my knowledge of allaying anxiety, I could actually help them and allay this anxiety and they will stop feeling anxious. And another thing again I would also do is I'm going to be an advocate. I'm going to be an advocate in the sense that I'm going to let them know the things they ought to do during this phase and the things they do not have to do. And they also have to engage in exercise. And I also have the skill of IT. I know how to make use of computers where I would impute some of the medications that they've taken and because they have a written drugs that they always have to take. So with my IT skill, I'll be able to monitor the particular medications that they have to take, and I'll know when they have completed their dose and cell to arrange it with their needs in order to make sure that they are updated at every point.
All right, thank you. You've improved better. You've improved better than what you were before. So you can build on that, okay? You can build it, like pick 3 or 4 that you think are the most important. It must be essential. There must be an essential stuff that they need. Not just, we don't want desirable. The essential one before you can add some desirable that they need. Okay, so thank you about that. So next question is, can you tell me about a situation whereby you made a mistake in the hospital or in your care and how you were able to overcome it and what was your actions? Now, those that are saying they're in Canada and all that, this is a Canadian question, no? And it's also a UK question. So I'm trying to mix in between both of them. So this is a general period. So can someone answer? I need just 2 people. I won't prolong it this time. 2 people.
Okay, so can I continue?
Oh, you have an answer to this one.
Or should I allow somebody else?
Whereby you made a mistake.
Yes,
and you were able to, what did you do? And how were you able to improve from it? Okay, so go on.
Okay, there's this day which is on the 2nd of March. A doctor prescribed a medication where we have to give this. Was a patient that just came out from the theater, and we're supposed to give IM pentazocine. And I thought I saw IV pentazocine, which is intravenous. So in the process of mixing the drug, because we don't give it directly, you have to dilute 1:1 ratio. So in the process of doing it, I had to go back to the book to just cross-check to be sure. And I found out that what was written there was IM, but I've already diluted the drug to give it for IV. So what I did was I quickly called my supervisor and I showed her and I told her that this was the mistake that I was about to make, but I haven't served the medication. So what we did was we discarded and then I gave the medication through the right route.
Okay, thank you about that. Can we have one more question? Can we have one more person? Yeah, confidence, you're raising your hand. Speak, please.
Yes. I'm going to answer this question based on what the last class, because Mr. Otaibe advised me to go and watch the last class before, because I didn't know that we are going to have this section. So I'm going to answer this particular question according to what Mr. Otaibe said. So this is how I'm going to answer the question. I've not really made an obvious mistake since my practice as a nurse, but I can remember when I made a mistake when I was a student. That was I discarded a patient's urine bag, and I couldn't. I documented this somewhere, but I didn't document it in the patient's record. So when my supervisor was about to write a report and she found out that there was lapses, she called me. She had to cross-check the people that she assigned duty for. She assigned to that person, and it was actually me. So she called me and asked me why I didn't write the urine. Why I didn't write the amount of urine I discarded. So I now told her that I forgot. Then I brought out where I wrote it and gave to her. So at the end of the day, she lectured me and all the students there about the importance of proper documentation, because it can cause a lot of problems if there are lapses in documentation of patients. Thank you.
Okay, thank you so much for the answer that you have given. Just 2 things I want to mention. So you guys have done well, okay? So Miss Precious, the reason why she went the other way was in the last interview session we had, we said whenever you are asked this type of question, it can be quite tricky. And at some point, yes, I like the answer you gave. Why I like the answer you gave? You did not say you made medication error. You said you were mixing the medication, but then you discovered you wanted to go and check again to be sure of what you were doing. But we always say the safer bet to escape, so that some people that maybe they are looking for, maybe you have been doing well, but they're looking for one thing to come and use and hold and say, this one that almost made a medication error. What if the person come and make medication error in our trust? We said we can use an example of when I was a student, when I was in my learning period, when I was still under supervision. That was when I made made a certain type of mistake. And you should make sure that the mistake is not one of your core skill like maybe administering medication to a patient. You understand? Yes, we already know as nurses, right, that at times you can make these errors, and they know, but you are trying to show that you are the best of 1,000 applicants. So you have to ensure that when you are giving an example, that is safe. Okay, like me, when they asked me when I was still in Nigeria a long time ago about this, the answer I gave then was that temperature. I forgot to document my temperature. So temperature, we not like it was I forgot to document it, but that was when I was an intern learning. Okay, so it's always safe to play that safe bet so as not to your call like medication that they know that that kind of thing. You just want to play safe around it. Okay, so that's what we just said. It's just to help. It's not like we are saying we cannot make mistakes. It's just that there are so many people for that role. You want to show that you are the best. And even if you make an error, another thing you need to mention is when you make an error, you mention steps that you took to make sure that you don't make, like maybe attend seminar, read the trust policy or hospital policies and all that. Okay. So next question I want.
Yeah, before you leave that question, I spoke about this in the last session. So please, if you can, try and watch that video. It really helps you a lot.
Put that cloud for me.
The only thing it will cost is data, but trust me, these interview sessions we are doing can actually save you from traps. Now, before an examiner will ask you a question, ask me why. Why are they asking you what error did you make? Why are they interested in the error you make? There are two things they are asking for. They want to know if it's error that caused serious harm to patients. Number two, what did you do afterwards that made you to have learned from it? Number three, how sure are they that you will not repeat that same error? Are you getting it? So that's why you have to be very, very careful. Error plenty, yakpa. Don't use medication error. I always advise, don't use medication error. You know why? Because in NHS, we have OSCE class now ongoing. It's just to get people on board. If you're interested, you join the training. Now, in NHS, there's what they call the right of medication administration. You talk about right patient, right dose, right drug, and dose. Now, for you to make mistake in the route, it means you've already broken a code of the right of medication administration. So that means you didn't follow the right of medication administration. What does that tell you? Indirectly, you are putting yourself at the bad side. And then when you now finish, say you and your colleague, she now came, she assisted you and they gave it in the right way. Good. Is that all? How about doing computing an incident report of a potential harm that will have happened that you didn't speak about? How about doing a reflection where you will write a note on what you could have done better? How about attending teachings so that you now did a personal training on that particular course so that you don't make that error again? How about those? So you have told them you made an error, but you have not told them that you follow the procedure in removing the error. You understand? So that's why we say that play the perfect person. Act as if all your mistake, even if you want to give error related to medication, say it when you were under supervision, because when you are still a student or an intern, but then you are allowed to make mistake. And these mistakes are not counted against you like serious big mistake. They are counted as, oh, you are under supervision. So every mistake you made, the person that is supervising you is also responsible. So there are so many minor error in nursing. You did your ops, you put it in the pocket because there was an emergency situation. Once you were supposed to record it, you forgot to record it. That's an error. But there was an emergency situation that caused it. And afterward, you now learned, you were trained, you were taught. And then you now did your personal reading on this topic. And so far since you'll be practicing, such error has never repeated itself. You were trying to empty a patient urine. You empty, you didn't document. Those are not grievous errors, but they are errors in practice. They happen when you were much younger and you learned from it. You were supposed you were working with your fellow student nurse. A patient, your colleague was speaking to a patient rudely. You actually did not show your colleague then because you thought if you did that, it will be a problem because you don't want to create a scene. So you instead of you taking action, you kept quiet until the whole thing finished. And when you were a student, this was when this happened. That's an error. What do you now learn from it? You were educated, enlightened, this is the procedure, this is how it's supposed to be, and this is how it's supposed to be. That's an error. So they are not medication related. Anything that will lead to patient death, don't talk about it. Why? Because there's this thing. Why are they saying that some persons in some country, because they have been committing crime, they have traces of crime in them? Because they believe that naturally, anybody that have committed an offense or a crime, there are chances that he will commit it again. So give the error that is safe error, safe error. Yeah, they are error, but they are not enough to cause harm. And when they happen, they were during your training. You may not use urine. Have your own. Think of your own. See, let me give you an example. When I was still applying for a job back then, there was a question I got in my trust. They said, on one of the interview I went for, because I got so many interviews before I eventually settled for one. They say, tell us how you are being innovative. I said, okay, thank you so much for this very question. I myself personally, I believe that I have always been innovative right from the time when I was in secondary school to my university days. But I will remember this vivid scenario that there was a day that during this COVID era, there was a lot of busy work to be done in the hospital. As a result, we were lacking sharp buses. I actually have to make a sharp bus using the available carton that was available in my hospital. In the course of doing that, the CMD of my hospital actually came around and saw what I did. From that day henceforth, I was tagged the innovative nurse. So everybody was smiling, oh, good, it's good, that's good. But in my mind, I said, good. You understand? So you can just create something from nowhere. What is innovation? Creating something from nowhere. Did I solve a problem? Of course. Was I called the innovative nurse? I don't know. It's you that know that one. Do you understand? But did I meet what the interviewer is asking for? Tick. Did I get the job? Tick. Will you not come and be asking me, how did I answer the question? The thing is, give the examiner what they want to hear. Now, the examiner is want to also hear you say you make some grievous mistake. If you go that way and you give the examiner what they want to hear, they're also willing to what? To mark you down. So that's why there are so many questions that will come. Imagine you have been doing well in other questions and they will not bring this one come. They will not use this one to judge you. They will not say if you do well, but accept that mistake. When you finish your interview, they will discuss your matter. Yeah, his good was very good. Yeah, very good. But I said that he said he made that mistake. But you know, that can be dangerous for a patient, What if he does it again? You know what I mean? Yeah, you are right. The other, you should consider the other nurse. That was also equally good. Yeah, you can send the message now. Do you understand what I'm saying? So make safe mistakes. And always, why do you do internship? The other training where you made all the errors. So use those ones as your advantage. If you did do internship, you were once a student, and during your studentship, were you not doing posting? You understand? Make all the errors there. But not when you are practicing. When you are practicing now, come like you sabi. You understand? Like error no dey happen. You follow CCs, you follow the right of medication, follow everything. So since you have made that error in the past, you have now refused to make any error. So that basically she's distracting me. I go back to Stella. Thank you so much.
Thank you so much for that. So next question is, can you tell me about a scenario whereby you had a difficult patient and how you were able to manage the difficult patients? This question is for both mental nurses, both what's the name, general nurses, surgical nurses. You will definitely have a patient like that. So give an answer. Thank you. Confidence, you can speak. You see all the confidence that is here. We have over 18 people. Hey, anyway,
No,
confidence. You are ready, so
yeah,
be confident.
if you are not speaking now, don't think on that exam day you will do magical. Make all the mistake here now. Let them correct you. If somebody has not spoken about medication error just now, she probably may not know. You understand? It's not as if it's a bad thing. You get, but it's all about combining knowledge. She's doing greatly, and now she's learning. But you keep your mic muted. You are just on this session. You are wasting your time. You spend time. Remember, you spend time to join us. So it's almost
About 2 hours.
2 hours now.
Yeah.
2 hours of your time. You have not been able to open your mouth to even answer any question or contribute. And then you think you are doing me. You are not doing me. Oh.
You need to say it, though. Don't think you know it in your mind. You need to say it out to be sure that you've structured it. Anyway, since we have people that are ready to speak.
Can I still continue?
Let's confidence raise their hand first. Confidence, go on.
Okay. All right.
Okay. I understand that encountering difficult and demanding patients is part of our day-to-day experience, or it's part of our day-to-day experience. And there was this time I encountered a difficult patient. The patient wasn't happy about the treatment that he received by another nurse on duty. So first of all, what I did was to actively listen to this patient's concern and complaints and allow them to express and allow this patient to express their frustration. Then the next thing I did was to approach them with empathy and compassion, and I recognized that this person was going through some emotional and physical stress. Then I also made them to understand that I am ready to help them. Throughout the whole chaos and everything, I remained calm and composed, regardless of the demands and behavior of the patient, because it does not just help to de-escalate the situation, it also sets a professional example for these patients. Then I also use clear and respectful communication to address this patient. When the patient became disruptive and unsafe, I firmly but respectfully set boundaries and informed him about the consequences of his action. Then I also involved the healthcare team because
Please go on. I'll mute the person. Just go on.
Okay, because involving these healthcare multidisciplinary teams helps at times to de-escalate the situation. Then I maintain thorough documentation of the patient's behavior, my intervention, and the discussion I had with the multidisciplinary team, and also what they did. Then after the whole scenario, I practice self-care by seeking support from my colleague, because I know how dealing with a difficult patient can bring an emotional toll on the health of the person that handled the situation. Then I also did a self-reflection of my practices, and I identified areas that needed improvement, so that in case such a scenario happens again in future, I will know how to handle it better. Thank you.
All right, thank you so much for that. You've done well. Let's have a B Hirime Odianose speak. Precious, I did not call you because you've spoken before. Okay, all right, good.
Good evening.
Good
Okay.
evening.
Thank you for this question. There was this time when I was in my current place of work, I had this particular patient. It was difficult creating or establishing a rapport with her. The thing is that I had to ask other of my colleagues, of which they told me the same thing. That the patient refused to talk to anyone, and she had been withdrawn and kind of aggressive. So and this made it difficult for us to be able to uh, um, attend to the patients properly. But what I did was to, try and create a time for me to see the patient. Then after which I listened to what her fears. If she was frustrated, she opened up to me without me judging her. So I've engaged in active listening of her complaints and understand her emotions and the experiences that she must have had in the past. That's why she was being withdrawn and become aggressive to us. Then secondly, I try to, establish boundaries. Based on I want to be empathetic, but I will just try to promote a safe and therapeutic environment for a patient for her. So then I created a good rapport with her and ensured that she was well taken care of. Then after that, I consistently check on her. I let her know that she shouldn't worry, that she's in a safe space, and following her made me. It also helped to build the trust that she didn't have for us, the healthcare professionals. So following her consistently and letting her know that she's in a safe environment really helps to build that trust back. Then I also informed the multidisciplinary team in which I was working with, the psychiatrist, the social service people about her condition, and we were able to devise a care plan in order for us to take care of her properly. And she was also involved in the planning process of her case. So that's the period in which I've had a difficult patient and I was able to, come in and help.
All right, thank you so much for that. Do anybody have anything to add? I mean, if they've said what you want to say already, it's fine. But like, we just want some so we can move to the next question. Do you have anything you want to add to it?
Yes, I want to add something because there was a time where I had a patient, which is a pregnant woman, as at the point of delivery, everybody was trying to tell her to open up her leg to allow the baby to come out, but she kept struggling and struggling. And so we had to call in doctors that were able to hold her. And after like 45 minutes, because she really struggled a lot with us, because she didn't want to. So after the whole struggle, but she still gave birth to a very bouncing baby boy.
Okay, all right, that's fine. At least it shows that you guys were like you had to, for something that was difficult, you had to come in to support her and you were there for her, caring for her. The great speak. Thank you so much, Precious. The great, I saw your hand. I want you to speak because I don't think I've heard you say anything. So the great, can you say something? Don't put your hand down. Thank you. Precious.
It's all right. Thank you so much for this question. As an
Okay.
experienced nurse who has worked with a vast range of persons, patients with different temperaments and characters, and I try so much to respect my patient's opinion, trying to understand their concern and what they need at each particular point in time. And this has helped me to render individualized care to them. So it happened that there was a time I wanted to give a drug to a particular patient, and this patient refuses medication. So what I did in this scenario was to communicate effectively to this patient, know why he's refusing the medication. So after I allowed this patient to talk to me, I was able to calm this patient, reassure this patient, and afterwards, this patient opened up to me that he has been taking drugs for over 15 years and that he's tired of taking drugs. So I follow this patient with empathy, being that it is not considering the condition, taking drugs for over 15 years. So I felt for this patient, but I had to also reassure, encourage this patient, telling this patient the need for the drug, why this drug has been prescribed, and that and indication and purpose of the drug. And after so much reassurance, uh, this patient decided to take the drug. So and I after this I ensured to make an incident report on this, escalate my line manager that this patient usually refuse drug, and what I did to make this patient take the drug for that particular time, and also to make to make other of my colleagues to be take cognizance of this patient, to know how to relay and communicate with this patient,
Okay.
to always
Thank
take
you,
the
the great.
medication.
Thank you, the great. Let me just cut you there. Thank you. You've done well. All of you have done well. So all you just need to do is to listen to this recording again and try to combine points made from each of you, and that will give you a good answer. A way you can give an answer to scenario-based question is simple. So you don't need to talk too much and don't say something. Do you understand? You can talk too much and you don't say something. So what you can do is you can use situation. You describe what happened, the task, what you have to do. You understand? The action you took, and then the results. So it's called the STAR technique. Situation, task, action, and results. Using that to help you talk about what they need, and so you don't talk about so many things and don't say what they want to hear. So thank you for that answer. Now my next question is conflict management. Conflict management is, what do you do, right?
Sorry, before you bring your next question, I know we'll soon be ending this session
Yeah,
now.
that's why I want to quickly round up
Yeah,
so
you
that
see
at
the
least.
importance. You see the importance of speaking in a session. Now, when the great was speaking, she obviously knows how to communicate very well. But you can see that there's something they call I sabi speak, oh, but sometimes it's still the who. You understand? So she was struggling at some point. For some of you that are keeping mute now, you don't talk. You want to give it to them sharp on your interview day. I hope you will be able to do it. So please, feel free, express yourself. Only a few times left. We'll be leaving this session.
Okay, I'll just ask you a question. Let me go to conflict management. So you had an argument with one of your colleague, or one of your colleague had a very bad argument with you. How do you resolve such conflict at work? Just speak straight up. Sorry, please, I'm sorry. Sorry. Okay.
Okay. Thank you for that question. At my workplace, if I have a conflict between me and my colleague, what I'll do at first is to, call the colleague to a private and a quiet room where I can discuss how it led to that and how we're going to resolve the issue. And secondly, I'll talk to my colleague in a respectful manner so that I won't add more problem to the problem at hand. Then after which I will try to report to line manager that see what went wrong during our shifts, that we had an altercation at workplace. If it's in the presence of a patient, I'll go back to apologize to the patient. And if the patient wants to make a formal report, then I'll send the patient to where he or she can make the reports. Then I will actually let my line manager know. Then I know definitely line manager will look for a way to solve the problem, or encourage us to go for a conflict resolution training, which will have much more idea on how to prevent it from occurring next time. That's what I would do.
Okay, let's have just one more person so I could ask the next question. Thank you for that.
As a nurse, I believe in addressing conflict directly and professionally. Then I also prioritize open communication and mutual respect. So if a conflict arises between my colleague and myself, the first step I'll have to take is to initiate private conversation to understand their perspective, and I will also express my own concern calmly and respectfully. Then I will listen to their point of view and acknowledge their feelings, and I'll also seek common ground. So by that, we'll explore potential solution and agree to a course of action that is fair and acceptable to both parties, that is my colleague and myself. But in situation where the resolution cannot be reached, what I'll have to do is to seek advice from my supervisor, but I will also maintain confidentiality and privacy at all times. Then, regardless of the outcome, I'll prioritize maintaining a positive working environment and focus more on moving forward. I'm focused more on moving forward collaboratively for the benefit of our team and also for the benefit of our patients. Thank you.
All right, thank you. So next question, sorry to everyone that didn't answer. So basically, how you could resolve conflict, everybody have said it's coming to speak with the person privately, try to come to a common ground to resolve it. And if it's not being resolved, because it could be due to many reasons, it could be maybe it may not be what happened that instigated. It could be like the person is having issues home, or maybe it was something that you probably have done before. You guys can resolve. If you cannot resolve, you bring in a third party, which will be your senior manager, to come in to resolve. If it's affecting the patient care, and also maybe the conflict happened in front of the patient, you could apologize and tell the patient if you want to report, tell the patient the places to report, and then document incidents if it has to involve a patient and all that. So everything all together. We've also done lots of conflict management, so many scenarios in other of our videos on YouTube. So I might not just be able to talk too much on it. So my next question, which is, we've talked about this, but I will not go directly. And we've asked this type of questions in our other videos, but I don't want to go directly. I want to go indirectly now. My question is, how will you recognize sepsis, and what is your management of sepsis as a nurse?
Yeah, can you just choose any of them and to answer that question?
Okay, those, especially those ones that are surgical nurses.
Yes.
And post-operative.
Yes. After all, they are having interview.
Yeah, so
to point.
Okay. All right, let me mute my mic then.
Okay. Mental health, I be sorry, maternity. Your midwife, your women know they experience sepsis. Is there no postnatal septic something?
Yes, that's why I actually wanted to talk, but you people said surgical, so I said let me just mute then.
It's same thing, so just go on, shoot the gun.
Okay. How I'm going to be able to recognize sepsis is one, for women that just finished giving birth that did elective CS, they always have
matches.
Go on.
Hello?
The person is just interrupting us. I've muted the person.
Okay. Like for women that just finished having elective CS, they definitely have a cut during the procedure. And after 5 days, the wound is being opened up. Now, how I'm going to be able to recognize that an infection or a bacteria has invaded the wound, it's the smell. One, it might have an offensive smell and it might be bringing out pus. And any wound that brings out pus and has offensive smell, definitely the wound has been infected. And at this point, definitely I would have to carry out wound dressing. Proper wound dressing has to be done. And after which, I would administer antibiotics to be able to control the level of spread of the microorganism to this particular place where the wound is located.
Okay. And also their vitals. What about their vitals?
Yes, I'm going to check, yes, because there would always be elevated temperature. So definitely I would do the vitals, and after the intervention that I've done, I will still check to be sure that this patient is fine.
All right, that's good. So that's specific to midwifery. Thank you so much. Do anybody have an answer specific to surgical? Okay, I'm not going to give an answer to that question. But what I just want to say is you've done well, Precious. That answer was correct, specific to midwifery. And because you have to check for the wound, obviously, because you gave an example. And then at times when you also check their pulse rate might be high, their blood pressure might be low as well too. Okay, they might be looking dry, and then you also need to send for blood to check. Maybe some of their blood tests might be high as well too. Then you also need to check their urine output. We call it buffalo. How to manage. Management is buffalo, which involves you check their bloods, their wounds. You've already said you've checked their wound, which is fine. So that's assessment. Now to manage, check their bloods, check their urine output, give them IV, give them fluids intake, okay? Antibiotics, antipyretic, that is paracetamol in case of high temperature. To check their lactates, to give them oxygen if they need it as well too, okay? So, and also like wound dressing as well in case it's a case of wound. And then how you can manage shock. Shock is almost similar, because that would have been my next question. But how you recognize shock is, especially you can give a case scenario for someone that is in a surgical or someone that is in a maternity ward. You can give for maternity, maybe a patient just had surgery and then you notice that their blood pressure is low and you just find out that they look dry. You just check. It could be that they are bleeding. It could be hypovolemic shock at that moment, or they are dehydrated, which could be also hypovolemic shock. You can recognize it in their vital signs and reduce urine output as well too. And management is giving of IV fluid, monitoring their blood pressure and all that. So that's how to manage all of that. Now my next question is, which will be kind of my last question or so, which I'll tell you guys to go and check out. So you guys need to go and check out medicine management, how you can recognize what do you do? Question like, what do you do when when you made a medication error? How will you manage it? You need to find an answer to that. For those that are in mental health, you need to find an answer to what is mental capacity. I asked this question in our last interview section, and exactly I asked 4 good questions for mental health, and the person had 5 questions, and out of that 5, 4 of it was the questions I asked in our interview section. And the 5th question, we kind of asked it somehow we didn't specific to them, but we asked it as well. So you need to know your mental capacity acts. You need to know your mental health acts. Please, I don't know, why did this person always do this? You need to know your mental capacity acts. You need to know your mental health acts. You need to know because I know we have lots of mental health nurses here. We need to know how to like what is safeguarding. If there is time now, the next question I would have asked is, what is safeguarding? Can you tell me how you manage a patient that have suicidal thoughts and how you recognize suicidal thoughts? How you manage that kind of patient? Can you tell me how you recognize signs of abuse and what are the various signs of abuse? These are interview questions that have been asked in previous times, okay? Then they'll also ask you questions like, okay, you are giving your patient medication, your patient is gaining weight, which is a sign or which is a common complication of mental medications. So how will you manage that? Okay, how will you manage risk? How will you do risk management and risk assessment? How will you recognize your patient is at risk? Okay, so those are ways to, how will you manage an agitated patient? Because at times mental health patients are agitated. How will you manage a patient in their euphoric states? So these are questions you need to know the answers to as a mental health person. Then for general nurses or surgical nurses, you need to know questions. I'm giving you your questions now. There's no time anymore because we've been here and we need to stop and go for a meeting now. So you need to know questions like, how can you manage a patient preoperatively? How do you manage a patient preoperatively? So you need to know about checking their, the preoperative assessments, all those preoperative assessments you need to do for your patients. You need to do that, okay? And then also postoperative, how you manage a patient. Then how do you manage a patient that is confused, or you enter a patient's room and you see a patient on the floor? What will you do? If you enter a patient's room and then you see a patient is unresponsive, what is your actions? In all those cases of unresponsive, cases of your patient is on the floor, what you need to do is you need to first and foremost check for scene safety, because one of the principles of nursing is that you need to ensure your self-safety and also the safety of the patient, but yourself first. And then you check for safety, then you call for help. When you call for help, before you can start taking any approach towards maybe helping to, if it's unresponsive, you check for the vitals, check respiratory, and then you can start cardiac CPR, and then when help come and all that, inform patients relative if the patient wants you to. The doctors will be there already. Go keep monitoring the patient over time, document what has happened. If it's the case of a patient that is on the floor, make sure you are not lifting the patient by yourself. You call for help. When the help arrive, then you and the person will use manual handling techniques to take the patient back to the bed. And while you are waiting for them to come, you can do some assessment, checking have the patient broken any bone, is there any wound, do a GCS assessment, is the patient, is there any sign of stroke, is there sign of confusion, is the patient still having a good GCS of 15 or has a reduced GCS, and inform the doctors to come and review the patient, and then do we need for an x-ray or any other investigation. And then if the patient wants you to inform their family, fine. If not, you just let the patient know what's happened, and then if you also document what has happened. And in case of how to manage pressure ulcer, they could ask you questions like, how can you manage your pressure ulcers, or how do you prevent pressure ulcers? So you just remember the point of checking the patient's skin, also assessments, removing crops from the bed, ensuring that there is repositioning of the patient frequently, ensuring that your patient has good nutritional intake, okay, good nutritional intake and all that, good hydrations. All right, so these are ways to manage pressure ulcers. Then how do you manage patient that has a fall, or how to prevent fall? Make sure the patient bed is at the right level. Okay, this is also for those that are going for healthcare assistants or healthcare practitioners, or how do you manage a patient, prevent falls? Bed needs to be at the correct level. Call bells or call assistants needs to be close to the patient. Patient has the right foot wearing. Any hazard that's around the way is being cleared away from. The patient is using assisted aids, you give the patient to assist and bring it close to the patient. Make the patient understand the importance of the environment, or know where important things are, like where the toilet is and all that. Make sure that there's good lighting in the particular in that particular environment and all that. So that's how to manage the case of fall. There are so many other questions, so many cases of what's those going to community health. How will you manage? Go to a patient's house and the patient is having high blood sugar, hyperglycemia. How do you manage this? If you go to a patient's house and you notice that there's a sign of abuse at the patient's house, how do you manage this? Okay, if your patient is being difficult, how do you manage this? All these questions, like I said before, are related. So if you already have a concept of what they are going to ask, because I've told you of the concept already initially, you'll be able to know the right answer to give. So for the sake of time, we'll have to stop this interview section now. We've spent over 2 hours, going to 2 hours 30 minutes, and I hope that we've been able to help you. I'm going to leave the floor now to Mr. Ace to speak. Thank you so much.
Okay, you see, it's already dark on my background. I should have turned on the light. But anyway, thank you so much, everyone, for taking our time to be a part of this session. We actually exhausted our time. For everyone that spoke, great, thanks. We'll try and make the video available to you afterwards so that you can replay them and then get to use it for your practice. Please, I beg you in the name of God, please watch other videos on the channel. Watch other videos on the channel. I'm not telling you to watch other videos on the channel because I need your view. Your view will not do me anything, but it will help your journey. There are so many things, so many contents that we've already given out previously that can really help you. So all you need to do is watch those videos and get that help so that you will know that you are properly directed. And after you finish your interview, please, all we only appeal for is post your experience, post your past question, the way it came, the trust, the name of the trust, the date you had the interview, and some question that came out. Anyone you can remember, even if it's just 5, 6, 10, 1, Post your past question. We'll share it on the Telegram group so that people that will come in the future, they will be well guided. It is hard to get interview nowadays, but let's help our own so that wherever you decide to go, whether UK, Canada, Australia, you always have your neighbor to call upon for one or two. You are looking for something where somebody will have given you 10 naira before, it's giving you 20 pounds. It's the same money, but different power. So that means a whole lot, and it can go a long way because of the little help you have used to help another person. So we are appealing to you. After your session, we made this sacrifice. You are not paid off for it. The only thing we ask for you is what? Help other persons that will come tomorrow. Because your interview that is coming next now, if you know all the questions by heart, you will use different app to prepare. You will ask your friend to ask you this question and you will give answers, and then they will respond to you. And beyond all this, if we stop this session, it doesn't mean it has ended. You have your colleague that are still on the same group. Whenever you have the chance, please post on the group. I want to have interview preparation with somebody today. Are you ready so that we can start a WhatsApp call? Whoever is available will be on that session. You both of you will learn from each other. There are persons they will also share their experience. Why did they not get it and why they got it right? There are some persons that joined the group that are actually successful. We only added them. Time will not permit us now. I will say share your experience. But they too can also join your own interview session and then they will tell you, okay, this was how I got my interview success. So by also doing, we'll be helping each other to achieve our goal. The Telegram group is there for you. Share the link to your colleagues and friends that are actually looking for interview to guide so that they can know what they are to expect. Whether you are based in Nigeria, based in Ghana, UK, or whichever country you are based. Truth is, tomorrow you may want to change trust and you may give this past question. So it really go a long way to helping everybody. Uh, Thank you so much for your time. I will give few minutes for one or two persons or everybody to give their review. Then we can call it a day. Thank you so much, everyone.
Okay, good evening, sir. Thank you so much for this great opportunity. Sincerely, I think this was actually meant for me because I think I learned a lot. I'm someone that is very vocal. I like talking. So that's why at any point, I'm always ready to talk. So I am grateful that I was able to notice that some of the things I thought were right, I just noticed that they were wrong. So learning from the best is actually a privilege. And sincerely, I'm not going to take this for granted. I think this is like the best thing that's happened to me today, apart from service that I went for. Thank you so much, and for the time that you actually brought out to give us from the bucket of the knowledge you have. Sincerely, I, for one, I am grateful, and I'm very sure that everybody that is listening actually benefited in one way or the other. Thank you for, I think, your wife that spoke. Thank you, Ma. This is actually a privilege. Learning from you was really a blessing. And may you not get tired, may you not get weary to dish out this information and this knowledge that you have. Thank you.
All right. Thank you so much, Presh. Thank you so much. It's an honor. We can only but do our bit. As we said before, we appeal to you after your interview to share your experience also to be able to help other persons. Thank you so much. Should we hear for another person before we call it a day?
Yes. Hello, good evening, sir.
Hi, good evening.
Sorry. Yeah, sorry I got the link late. About 7, the session has already gone far. So, but please, I plead that another time I'll get the link on time so that I can start with you. But for the little I had, I'm grateful. Thank you.
All right, no problem at all. So we are going to share the link. Everything here, you haven't missed anything. They are all recorded. So we'll share the link so that everyone that missed will be able to have a grasp of everything that was discussed in this session. You can also share it to your colleague if you gain access to it. Don't worry, it's not everybody that will watch the video. It's only those that say that will watch it. That's how it is. So please, let's do our little to help as many as possible on this journey. Thank you so much, everybody, for taking our time to be a part of. Thank you. Mrs. Stella, I appreciate you for also giving your time. Mrs. Precious or Miss Precious, Miss Confidence, Miss Blessing, is okay. So many of you, Mr. Solomon, and so on and so forth, that spoke. Thank you so much. We cannot appreciate you all enough. The only thing you owe me now is share your experience so that the future nurses that will be having their session tomorrow, we can be a blessing to them. They can also hold their hands together and say, God bless this person that gave this past question to the Express platform. And because of that, I was able to know what to expect and I smashed my interview. Please, once again, it doesn't end here. You can create a session just to create a WhatsApp call and people will join. And both of you will hear from each other. Many have watched our video, some have not watched it. They can also correct you. Everybody correct each other and then will become a greater or better person. Have a great day, everybody. The session will be
Just
ending.
to add,
Pray
just
for
to
us,
add,
so
just
especially
to
for
add.
us having interviews this week.
No, God will see you through. Success is coming for you. Everything will go well. Now, also take note, if you are not successful in your interview, it may not be that you are not good enough. Now, let me give you an example. Recently, we applied for application for a nurse assessor role for our OSKID tutorial. Now, over 1,000 persons applied for that role. Now, when we were doing the interview, we couldn't shortlist everybody. We tried to shortlist less than 100, over 1,000. Can you imagine? Do you know how many people left that shortlisting? There were a whole lot of persons that are way better than the ones who may have shortlisted, but they didn't meet up with the shortlisting. And then the people we shortlisted, who were interviewing them, majority were so good. Now they are so good. We cannot say, oh, we want to take everybody because we don't have the power to take everybody. Are you getting it? So sometimes during your interview, you did not get an offer, may not be that you are not good enough. It's just that the trust decided to shortlist more than necessary to the point that they are now confused on who to take and who not to take. That's where grace also comes in. And I pray that grace will follow you in the course of your interview.
Amen. Oh.
Thank you, everybody. Have a great day and success ahead.
Thank you.
Just to add, there's someone that said something about, put on the comment section about mental care practitioner. I've gone to go and check your job role and your job description. It's relating to, they're asking, are you a mental health nurse interested in working with mental health and all that? So it's still relating to mental health nurse questions. So just know that your question is relating around mental health nurse questions. And because they title it as mental practitioner, they might ask you more of a general based questions relating to mental health, like all those questions like difficult patients, mental capacity, and all that. They might ask you those sort of questions. All right, thank you. I don't know if the person is
Mrs.
still
Stella,
here.
please, one more thing. My own is home first practitioner. I
Home
think
first is community based now. Home, just like the name, home first is community based. So make sure you are focusing your attention on community based questions. Okay, community based questions. Focus your attentions there. I mentioned some questions. Maybe just rewatch the video. I've mentioned some community based questions that we've had, and also on our Telegram group, we've dropped community based questions a lot. So you can just click on the search button there or click on the pinned messages. You will see community based questions.
And one other
Focus
thing,
on them.
the community-based question. There are some of you that you have interview with Dorset. Please, we posted interview question on the group. Most persons did Dorset interview recently. They all got their offer. So most
Yes,
like
they did. Yeah.
that's if you do the needful. And not just that, if you are applying for community health role, chances are you are going to get that offer. I don't know what is passing that message. Many people are not applying for community health roles because they feel, oh, it's a community practice. They will not shortlist me or they will not call
Yeah, they
me.
will shortlist you.
Yes, they are most likely to recruit you more than any other. All they
Yes,
just for you to have is that you have your international driving license and you can drive.
yes.
And once again, if any of you have gotten offer and they are telling you that, oh, we cannot sponsor you because of this and that, that's why you are not going to tell them that you can sponsor yourself. Currently, we have a platform that offer loan services for those who get the offer and want to relocate. We can fund your travel, but by the time you start working, you pay back. The truth is, the money that seems big in your eye now, you will soon realize that it's just your 2 months or 1 month salary. So instead of you waiting, when you know that currently the recruitment is getting low as a result of lack of funding for NHS, for international nurses, why will you say, oh, because they are not sponsoring me, I'm not going to go? Many people are doing self-sponsorship. You even have the offer. They are saying because they are not sponsoring me. We are starting hospital class very soon. So you go through hospital class, smash your hospital, start working, collect salary. Everything is still in the positive side. We are here to make it as easy as it can get. Hopefully, the platform will be a blessing to you. I will try and drop my number on the WhatsApp group so that all of us can also have one-on-one touch with everybody. And we for a follow-up, in case you need any further support, we can always be here to guide you.
Another person job say, what of you that is stomach care? You ask this question late, but you can just go and check stomach care assistant. It's all about stoma. Stoma is like and another, you should know what stoma is. An alternative to when someone can't pass to or from the normal anus, they create a stoma for a passageway. Okay, so you need to go and check about how to do stomach care, and your interview question will be based more on communication. Just note that how you can communicate it, because you need to know how to allay anxiety, because someone that is new to stoma, right, and the person is not feeling, oh, I'm feeling so bad, I'll not be able to go to toilet again normally. How can you reassure that kind of person, especially if it's a permanent or if it's a temporary one? How can you teach them how to manage it? So another thing you also have to look at is infection and control as well too. How to manage difficult patients too. So those are places you need to focus your energy on, and also know how to manage a stoma and how you can recognize signs that the stoma is not working or the stoma is infected, and how you can, because you're a healthcare assistant where you are going for, you are also going to be supporting the nurses in all this documentation and reassuring and all that. So just note that, just to mention. So thank everybody. Thank you so much. I'm going to be ending the section now. Thank you. Sincerely grateful for your time.
Bye.
Bye.
Bye. Thank you.